Welcome to episode 641 of Your Daily Detroit for Tuesday, November 24th, 2020. Hey, I'm Jairus Days and welcome to the show. Today, friend of the pod, Dr. Paul Thomas, joins me to update us on what's happening with the coronavirus pandemic as we head into the holidays. But first, I wanted to show some gratitude to our newest members. Our members, starting at just $1 a month, power what we're doing. There's some great benefits if you do more, but every little bit helps. So thanks to our newest members, Anna and Steven, they and their member counterparts are unequivocally the best around. You can join them at patreon.com/dailydetroit. Let's just get started. Joining me virtually is Dr. Paul Thomas, Plum Health Direct Primary Care. Welcome back to Daily Detroit, sir. It's good to talk to you.
Hey, Jared. Great to be here, man.
Let's start with some positive news around what's going on. I understand there is yet another new vaccine.
Yeah, it sounds like AstraZeneca just came out and announced that they've developed a vaccine in partnership with the University of Oxford. And they're saying that it's going to have a 70% efficacy, and that efficacy could go to 90% with a second dose. So that's really good news. And then the part two of that good news is that it looks like the storage temperature doesn't have to be negative 80 degrees Celsius, and that the storage is going to be a lot easier for people in hospital systems. So it may be easier to distribute this vaccine nationally.
That is excellent news, especially when you don't have to do as much of a cold chain when you're trying to distribute this stuff, because keeping things that cold, I mean, I don't think there are that many freezers that can do negative 80. I don't know about you.
I don't think so either. And that's a real challenge. I think Oakland County is trying to order those freezers and Wayne County is trying to do the same because it's not something that they just have on hand. Hospital systems are doing the same. So there's going to be a huge demand and probably not enough supply. So that's where that supply chain starts to break down.
I mean, who knew the runs would be on toilet paper and extremely high-powered freezers, right?
Exactly.
This whole situation never ceases to surprise. I want to talk quickly about something that has been in the news the last week. We are coming up on the holidays. We've touched a bit on the holidays, but there is now more data out around what people are doing. According to a study from cars.com, 47% of people are traveling for the Thanksgiving holiday week. ABC News reported this morning that 1 million people a day are getting on airplanes. That's a pretty stunning number considering how much community spread that there is out there.
Yeah, and then also considering one of the best places to get the coronavirus is sitting on a plane. That's like one of your higher risk things, along with going to a bar and a sports stadium and things like that. So it is challenging. I understand that people want to be close to their families and need that, social touch sometimes to get through difficult times, but it's just not a smart idea because there is so much community spread. I saw a statistic that said something like 1 in 370 Americans are infected with the virus right now. And so it's out there. If you don't know somebody who has the virus, you definitely know somebody who knows somebody who has the virus, and that chain is getting shorter and shorter. So it's going to be really easy for this virus to spread. I think we saw a huge spike over the last 2 weeks because of people getting together to vote. And I think we're going to see another spike after Thanksgiving if people choose to get together for the Thanksgiving holiday.
Yeah, one of my friends was talking on social media about, it's pretty quiet in here. It's basically two types of posts. One that is the people who are saying they're staying home, and then complete silence on the other side. Which, is a little worrying for me personally. Another thing to think about, too, is when you're indoors in small groups, so many experts right now are talking about how even if you know somebody, you don't know if they're infected, and that there are some tools online as well that are showing that depending on where you're going and where you're from, it can be anywhere from like 1 in 5 to like an 80% chance that somebody in that small room has coronavirus.
That's a real challenge here because the more people you gather with, the higher your chance of getting the COVID. So the best thing to do is to keep it small, 1 to 2 households gathering for Thanksgiving, and then everybody else joining by Zoom. I've seen a meme going around, don't take me out of context here, but it's better to do a Zoom Thanksgiving than an ICU Christmas. And that's really what we're trying to avoid. We're trying to avoid the virus going to our highest risk relatives, like our grandparents and older uncles and aunts and things like that. and preventing them from getting the virus, where they may end up needing to be hospitalized in 2 to 3 weeks because they caught it at Thanksgiving.
What I've learned over the years is that some people are going to do what they do, and they're going to look for median things to reinforce whatever it is. And sometimes we can't necessarily convince people out of doing something, but help reinforce things. And I want to make sure that people listening know, if you decide that you're going to forego or do by Zoom, I think that's okay. I really think it's important that people know that people are there for them, and that they, that I think it should be totally acceptable if someone feels like they want to do it remotely. I don't think they should be shamed for that.
No, I think it's totally appropriate in this time. I mean, I would rather do a Zoom Thanksgiving than know that I contributed to an illness of a family member. Because, there's always going to be next Thanksgiving. But, if you infect somebody in your family and they suffer from coronavirus, they miss work, they get hospitalized, and potentially die, that's not something that you can take back. So, one Zoom Thanksgiving in my lifetime, I think I can live with that. I wouldn't be able to live with giving the virus to an older relative and having them get really sick.
Well, and that loops back to that whole conversation with the vaccine. There's light ahead, and multiple lights are turning on as we do this week by week.
Yeah, and there was actually a report that some, federal departments, some of these middle level, upper level bureaucrats have been told by their department heads that they could be receiving the vaccine in 8 weeks.
Ooh.
That would put us in January. Now, those are some higher level people in the government, but for us regular folks out here in the community, that means that we shouldn't be too far behind, in my opinion.
Well, one thing too that gives me some good thought around that is that you've got a number of people who are going to be taking these vaccines out in the field outside of like the controlled situation. So it's almost like a way to do another layer of double check with this testing. Even though it's an enhanced speed process, one of the things I've learned is that a large part of this last year has been testing these vaccines. It's not been developing them. It's been going through these trials.
Sure. And, I have patients in my practice who have been lucky enough to be a part of the clinical trials. And I had one patient describe it to me in great detail of getting the first dose and feeling pretty much okay, kind of like a flu shot, and then getting the second dose and definitely having some, symptoms from getting the vaccine, but ultimately recovering and being fully functional after about a week of feeling basically run down, fatigued, and that sort of thing. So I'm really excited to see more people in our community get the vaccine, because as more people get the vaccine, the closer we are going to get to that herd immunity, and we can ultimately stop the spread of the virus and move on with our lives.
For sure. And that is the fastest way to herd immunity, because doing it through natural spread, like some advocate, I believe is pretty reckless and going to cause a lot of damage, right?
Yeah, it's extremely reckless, and it would involve a lot of people dying from the coronavirus. Whereas if you know that you have a safe and effective vaccine, it's best to go with that option, because one, you can distribute it faster. You can have more people take the vaccine and be protected. And two, you don't have the risk of dying from the vaccine like you do from getting the coronavirus.
Well, speaking of vaccines, let's talk about a new University of Michigan study that is kind of sounding some alarm bells after it found that a good number of Detroit residents do not think that they will choose to get the coronavirus vaccine when it becomes available. Apparently, nearly 2/3 of Detroiters say that they are unlikely to do it. Those from communities of color are much more likely than white folks to decide that they're going to not get it. So Hispanic or Latinx communities were twice as likely to say they would not get the vaccine. And for Black Detroiters, that number is 4 times higher, which is kind of insane on the face of it. But I think we need to talk about some of the underlying systemic issues that could be driving some of this.
First, let's talk about the study. They sent out 1,600 surveys, and then they had 1,000 people complete those surveys. There's a 4.5 percentage point give or take on those stats. But that being said, I think that study is well done by U of M, and I think that's a good data point. And it points to the distrust that folks in the community have for medicine and medical care. And taken in a greater context, it's really understandable. If people aren't aware, there was something called the Tuskegee study, where African-American men were not treated for syphilis, even though they knew that they had syphilis, even though scientists and doctors knew that these African-American folks had syphilis. They went untreated so that they could be studied by white scientists and the government to see what syphilis would do to the human body. And so there are studies like this in our history that breed distrust among people of color, among African American folks. And it's really important that we as a scientific community are open and honest with our past failings as a scientific community. And if we can have these open and honest dialogues about these mistakes and errors in judgment, hopefully we can move forward and educate people about the safety and efficacy of these vaccines and get more people to take these vaccines to protect themselves and the community.
Yeah, when I see a number that at first sounds kind of bonkers, to myself, I first go like, okay, if my shoe is on the other foot, what's driving that and what is making people think that way? And there is that fear in the community, which is very unfortunate because things have really improved in the last 50 years, as well as the death rates for people of color is still really high when it comes to the virus, even with this new wave.
Yeah. And, like we've talked about in the past, people of color, people who are vulnerable, both physiologically and economically, bear the brunt of any pandemic. And so in the case in the United States, people of color here in Detroit who are low income, who have to work in jobs like, let's say bagging groceries or stocking shelves or driving buses or cleaning public areas are going to be more likely to come into contact with the virus, more likely to get sick, and they may not be offered sick days. So they may feel like they have to continue working and therefore spreading the virus further into the community. So, there are a lot of economic, social, and physiological factors that go into African American folks in our community being more vulnerable. And it's something that we need to address as a society if we ever want to, face the next pandemic with a more robust response.
Well, a student of Detroit history will know that systemic racism and inequality in healthcare is a very real thing in this country.
Yes.
So let's end with a listener question. We get a bunch of things like this, but this one is from Debbie. I'm going to kind of summarize it. She talks about a specific district of Plymouth Canton, but I'm going to widen it out a little bit because we've gotten multiple questions along this line over the last couple of weeks. Would you be able to address the schools closing during this pandemic in Wayne County? She just listened to you again say that K-8 does not learn well remotely, yet so many districts, including Detroit and my district of Plymouth Canton, are closed. She has the thought that it's terrible and the lack of prioritizing education in the state. I will set aside the educational side because neither of us are educators per se, but I think there is both a health and a policy component to this. So I think maybe, Doc, we could tag team this one.
From the health side, I think the governor is trying to look out for the best interest of our health and safety, health and wellness in the state of Michigan. And there are risks and benefits to any decision that can be made. I think the high school students learn better remotely, and then children are going to learn better face to face. And, I think that what the government is trying to do is to limit the spread as best as possible. And it puts teachers in a difficult position because obviously you're going to have older teachers teaching elementary and middle school students, making the teachers more likely to suffer the consequences of the coronavirus. And I don't think there's a good answer for that, but this is where we are and this is what we have to deal with. I mean, in a perfect world, we could have everyone learning remotely, but it's just not that way right now. And I think teachers have a right to be upset about this policy because obviously if you are an older person, maybe you're a 60-year-old person teaching fifth graders or fourth graders, it puts you at a higher risk position.
Yeah. One of the things working on this for background was that the Michigan Education Association, the giant teachers union, has come out really pushing that teachers should not be teaching in schools, even if they're doing remote work. And one of the challenges is you do have a number of teachers that are in an older workforce. We actually have a large shortage of teachers right now. We don't have many people choosing to go into the profession. The other side, and I'm playing, I don't know if it's devil's advocate, but kind of trying my best from the research to elucidate the position, is that you're putting a lot of people in danger, even when you're dealing with remote work. The questioner mentioned City of Detroit schools. One of the things they're finding are little outbreaks inside school buildings when people aren't following protocols because they get lulled in that safety. Same thing about feeling like you're lulled into safety because you know somebody. If you're in person, you're in a shared workspace, you're interacting with people, that puts those teachers at risk. Another thing to think about too is that in our state, our districts and everything are very separate as far as the way that they are governed. Individual school districts have a lot of power in our state, and it's very difficult for counties and things like that to kind of push in other states. You'll see situations where counties and school districts, like a school district will be the size of a county or something. That just isn't the case here. It's very much a patchwork, and Michigan's laws over time really lean toward having small independent units of government. I don't even know if there is, outside of what the health department could do, I don't even know if there's like a direct way that a county can control a school district, because it's a completely different chain of command. So that's one of the things to think about too, is that each district is evaluating their decisions independently, their risk profiles, their individual teacher union representatives. And so from a policy point of view, very complicated. And I understand the frustration, but I also feel like there will be no good answers as long as this continues.
Yeah, I agree with you, man. You're facing an unusual circumstance, maybe hopefully a once in a lifetime or once in a century circumstance. And I think we're all struggling to find the answers. And it becomes even more difficult in the absence of a robust national response, where, like you said, all counties, states, districts, cities are all having to do this patchwork planning to get the supplies, equipment, and policies that they need to survive the pandemic.
Yeah, and with communities spread at the level that it is, and just the kind of feeling that I get talking to teachers is that there's a lot of worry on the teacher side. Having done some background interviews with some teachers, they're really worried about their safety out there. I don't know if that answers the question the way you wanted to, but I don't think there's really like a winning answer right now in any of this stuff.
No, I don't think so either.
Well, Dr. Paul, thank you so much for your time today. I really appreciate this kind of weekly check-in as we're dealing with stuff and your expertise.
Well, thanks for having me on, and stay safe out there, everybody. And it's okay to stay home and sit this Thanksgiving out to protect your loved ones.
Here are a couple other things to know today. On the heels of the 3-week temporary closure of Detroit's 3 casinos due to the pandemic, the city of Detroit has yet another budget problem to solve. Dave Masseron, the city's chief financial officer, informed City Council that it's projected the city will lose $10 million in revenue. If this lasts until spring, he says that number could increase to $50 million. Casinos, by percentage, provide more income to Detroit's coffers than property taxes. The city has already made budget cuts of nearly $350 million to deal with the pandemic's economic impact. Plus, in an update to a story we talked about on the show, Detroit City Council has unanimously approved a measure that allows for a variety of new recreational marijuana businesses to operate in the city. The eyes of the cannabis industry have been on Detroit, as it will inevitably become a, if not the, major hub in Michigan. The new ordinance, put together by a team led by Councilman James Tate, ensures that no less than half of licenses issued go to legacy Detroit residents, as well as other benefits including discounted land. Since it's a holiday week, here's what we have in store for you. Cheyenne's got her local gift guide, as Small Business Saturday is coming up and our neighborhood places need your support if you can do it. Plus, Devin and Randy are going to help us have a merry Boozmas with all kinds of ways to support local with your libations and accessories. And we'll be pushing the conversation forward with the stories you need to know around town. We're also working on upping our email newsletter game, so if you've got some ideas, go ahead and shoot them to me, jer@dailydetroit.com. You can also send feedback there. Some folks have lately. It has been great. If you have feedback you want to hear yourself on the air, we've got a voicemail line at 313-789-3211. With that, I'm Jer Stays. Take care of each other, and we'll talk tomorrow.